The Delta State Contributory Health Scheme is a mandatory health scheme for all residents of Delta State. And for us, being able to reach everybody in Delta State, irrespective of the person's socioeconomic status or the person's geographical location, is what gives us that mileage to achieve universal health coverage in Delta State. And when we were starting off the scheme, we had meetings with various trade unions, various organizations to get their mindset and their concept requirement to build the scheme. So they've been part of us from day one. And we have come to a level when we did a situation analysis and realized, no, we've not been able to capture as many of them as possible due to some administrative challenges. So what we're basically doing is rejigging the system, re-strategizing on how we can improve coverage of all residents of Delta State, particularly people at the lower socioeconomic status, people in the rural communities, people in the low income earning jobs. There's a new requirement that everybody that benefits from a health insurance scheme or a social program should have a national identity number. It's so serious now. For you to get your passport, you need a national identity number. For you to have a phone number, you need a national identity number. And this NIN generating system is not very available across the state. So over the years, we've been building a software that makes it very easy for you to get your NIN using just an Android device. It's called a Vexit system. We've developed it, we've taken it to NIMC. NIMC have accepted it, they've done all their test run. They are doing the user acceptance test today. Delta State is the only health insurance organization in the country that has been able to have a direct partnership with NIMC to be able to generate NIN directly. So what we've done now is that once we register anybody into the Delta State Contributory Health Scheme, that person automatically gets a NIN number. With that NIN number, the person is identified both in Delta State and at the national level. If there's any benefit program, social protection program coming from anywhere in the country, the people can be identified. So what we've come to do here is have a meeting with the Okada Riders and Tricycle Riders Association, discuss with them on how to make it convenient and feasible for us to be able to register them. So what we plan to do is that we've developed a network system of agents who will be spread across the state. They choose a location. As the Okada Riders are doing their work, they stop by there, their data is captured, their fingerprint is captured, their facial is captured. Through an API system, we generate a NIN and give it to them, and we give them an ID card to benefit from the health insurance scheme. They choose a facility closest to them, most convenient for them to go receive all the packages in a benefit program. So basically that's what this meeting is all about, to expand the inclusion of all residents of Delta State into the health insurance scheme, starting with the Keke Napep Okada Riders. When you're being registered, we collect your biodata, your biometrics. You will see a drop-down bottom of the facility to choose. So you just select from there. As much as possible, we want people to choose facilities close to their homes. Every facility listed on our program is already accredited for either primary care or secondary care. Primary care level 1, level 2, level 3. Secondary care level 1, level 2, level 3. So that not only do you get access to care at your locality, you can also be referred to a higher facility. And with the commissioning of Asaba Specialist Hospital, we've created a bigger process for that referral activity. So people choose the hospital that they are comfortable with. And if over time you are no more comfortable with it, you can come to us, give us the reason, and we change you to what is comfortable. We want to operate a health insurance scheme that is flexible, adaptive, and very convenient for everybody. We don't believe you should travel miles to go receive care. We don't believe you should go to a facility you're not comfortable with. The idea is make it flexible, make it affordable, make it easy, and make it convenient for everybody.
About 3 years ago, we had our first interaction with the Dschc who just left now, and at that time we saw it as a novel, and we decided to embrace it and give it a try. But in the first few months of the exercise or interaction or marriage or bromance, we had some teething issues which made it almost impossible to have the thing go seamlessly. However, in the course of time, we discovered that the problem was not actually theirs. There was an agency that was responsible for the capture of data, which could not transmit the data as they captured it. And they left most of the data, most of the items they captured in the data on default mode, which made almost everybody a female and most people males, or as the case may be, without differentiating. So this time they said they want to correct some of those issues and be able to have people reach facilities that are closest to them. Because if you leave the facility on default mode and you have Central Hospital Warri, for example, having about 2,000 people captured for Central Hospital Warri, when most of those people are living in Ika North, Ika South and all that. So these are part of the teething problems we had in the beginning, which they have agreed that must be corrected and should be corrected as a matter of urgency. And this is the reason why they have come back and they want us to begin the process of cleaning up the data and doing that which is necessary to get people to have access to this medical insurance scheme. I think it was the first of its kind in Nigeria as a whole. We must give kudos to him, and he has continuously insisted that Deltans must have access to free medical services, and that's why we're in this. We rejig the system such that we will have a majority of the people benefiting from this scheme. To quote Pareto optimality, the major good and the general good for the general number of people. So I think this is the essence of this re-interaction on the part of the scheme, and I mean the agency and this association. We know our people will get back to them, will be able to convince them. The moment they see that there are those who are already benefiting seriously from the scheme, you won't need to convince anybody, they'll convince themselves. So we are certain that this thing will work this time, because given the fact that NIN has been added to it as an extra package, it will be an incentive for those who do not have to actually key into this scheme. And that's my belief. Oh, it's a wonderful addition. We applauded it because we know that 90% of the riders do not have NIN. So it's becoming a problem for them to access certain social services from the government and all that. So now that it has been added, it's a major incentive that will drive the people towards the scheme. They will embrace it with both hands.